Hello and welcome, everybody. I welcome you all to a very special show today called Preserve the Uterus, in which we would be discussing protecting women's health by preserving the uterus. So, this Preserve the Uterus campaign is in collaboration with Bayer Pharma, and today we would be discussing on a very eminent and prominent topic going on in India, which is hysterectomy surgeries. So, as everybody know, hysterectomy is the surgical removal of the uterus of a woman's body. But this surgery isn't uh, is only prescribed to those suffering from some sort of uterine illnesses, such as excessive bleeding and pain. Another could be tumors, or if it is cancerous. Another thing could be uterine prolapse or fibroids. If hysterectomy surgery is prescribed in these terms, it is normal and advisable. If But we have been seeing in many studies that in some states of India, hysterectomies are prescribed to large number of population, even when it is not the primary call of treatment. So today we would be discussing that. I am Dr. Asavri Sawant. I would be moderating this show today. I'm the public health specialist for Team IHW Council. To discuss on this topic, protecting women's health by preserving the uterus, today we will be focusing on Andhra Pradesh chapter and discussing these cases that are very prevalent in Andhra Pradesh. To discuss the same, we have guests here with us today. We have Dr. LBSH Devi, who is the operating officer, commissioner of Health and Family Welfare, Government of Andhra Pradesh. Ma'am, we welcome you to the show.
Yeah, I'm a state immunization officer and anemia Mukta Bharat nodal officer. Yes.
Thank you, ma'am, for clarifying that. We
Yeah.
welcome you to the show. Next, we have Dr. Sharmila V with us, who is the additional professor and HOD of obstetrics and gynecology at AIMS Mangalgiri. Ma'am, we welcome you to the show as well.
Good evening. Thank you.
Thank you. We also have Dr. S. Lavanya here with us, who is the professor of Department of Obstetrics and Gynecology at Narayana Medical College. Ma'am, welcome to the
Hello.
show.
Yeah, very glad to be one among you.
Your video is switched off, ma'am, just to let you know.
Yeah, 1 second. Okay.
Thank you so much for joining.
Very,
Great
very
to have
glad.
you. We also have Dr. Manoj Saxena here with us today, who is the managing director of Bayer Zydus, and he is also the South Asia head of Bayer Pharma. So, welcome to the show.
Thanks a lot.
We also have Dr. B.S. Shiva Reddy, who would be joining us shortly, who is the chairman of Andhra Pradesh Medical Council. He is also the part of the discussion today. So, with that, let us move on to the questions. Let us move on to discussing this topic and the true picture of hysterectomies in India and specifically to Andhra Pradesh state. So, my first question is to Dr. Devi. Ma'am, as you work with health and family welfare, what are the alternative therapies and non-surgical interventions for issues like heavy menstrual bleeding and urinary tract infections and painful fibroids and all these conditions that are regularly that doctors should regularly prescribe? So what is the alternative therapies and non-surgical interventions that they can go for? Over to you. Ma'am, you're on mute.
Yeah. Sorry, there is a specialist or there, gynecologist, better to answer these questions for those persons. I request gynecologist maybe better.
Sure, I completely get you. Can you please let us know about hysterectomies and the true picture of hysterectomies in Andhra Pradesh state? We have read a couple of studies in which it is mentioned that Andhra Pradesh is at the topmost level, has the maximum hysterectomy cases all across India compared to different states. So, can you please share what could be the reason we have this?
Yeah. Actually, what happened, the studies happened at around 2006 or 7. Those years only the studies, two studies are there. That time, really, there is a in Arogyasri in our health scheme started initially. That time, so many hysterectomies done in that scheme, especially whatever studies mentioned in the Guntur district and other district. So that time is that is some reasons, lack of awareness or a scheme things or whatever provisions mentioned in that schemes. So that is the one of the cause in that study, whatever the studies mentioned those years, highly hysterectomies happened. And another reason is so many early marriages in the especially in tribal and rural areas in our state may geographically very different, because there is a Vishakhapatnam is there is a rural urban and some tribal area, and so many 4 5 districts are there. So there is a lack of awareness, and another things, hygienic aspects also very important, because you see in rural areas, those previously what happened, instead of the napkins, sanitary napkins, they used to frequently cloths and all the things. That is the issue also there, and because there is a viral transmission also will be there, because so many studies in Telangana or whatever we have done some studies there also. This is the issue, hygienic things also, and early marriages in that population, rural areas and tribal areas. That is the one of the cause, and migratory population also there in especially in Guntur district. Whatever so much migratory population also there. So these are the reasons. And one more thing, very thing is DUVs and early pregnancies. In between spacing methods between birth leading to pregnancy, complications and anemia, and these are the turning leading to dysfunctional uterine bleedings and everything. So lack of awareness in alternative treatment of the hysterectomy, that is the very important, because RMP practitioners, you know that in rural areas and tribal areas, they are misleading the persons, and that is the one of the cause. And another reasons, already I told you, uh, awareness is the very important, that is the thing.
Thank you, Dr. Devi, for sharing all those things with us. So, there are many things that you have shared that are a reason why such data is there. One is that, as you shared, that these studies were conducted in a limited time frame, as in around that period only. That is why we see more of these cases specific to Andhra Pradesh. Another reason that you shared was the migratory population and other such reasons also that you shared that have caused this sort of disturbance. So we will come back to you again. Let me just ask Dr. Lavanya first. Ma'am, you are the professor of Department of Obs and Gynae of Medical College, Narayana Medical College. Can you please share with us the physical and mental impacts of having a balanced hormone, system in the body, and if that gets affected after hysterectomies, and how? Can you please explain? Ma'am, you're on mute.
I think no, I
Yes,
am not.
yes, I can.
Just to tell, I'm actually working in Apollo hospitals right now,
Okay.
and I'm also attached to Narayana as a professor. Okay, so just my contribution to your talk is exactly why the increasing trend of cesarean in Andhra Pradesh. So around 22%, Andhra Pradesh has the highest number of hysterectomies recorded. So the reason being, there are so would you like me to enumerate, or shall I go ahead answering your question alone? Like if you
Ma'am,
want.
please answer both the things. Please start with what you wanted to say, and then, if you can, please incorporate my answers as well. Ma'am, we are having some network issue from your end. We're not able to hear you properly. No, not even now.
Mm, actually, my signal says it's good.
Now we can hear you. If you can just.
Yeah. Okay.
Yeah.
Is this okay?
Yes, ma'am, it's better, much better.
So number one is from the patient side. If you see, most of them are very, very so that is, am I audible?
Ma'am, in the middle, it's breaking again.
Am I audible?
Yes.
Okay. Otherwise, if I'll go to some other place and see, because if I'm not audible, please inform. I'll try some other place.
Ma'am, please keep speaking. We can hear you right now.
Yeah, fine. So the fear of cancer is the most important thing which actually pushes the patient to undergo hysterectomy. So that fear is usually incorporated in the patients by their relatives, second by the doctors themselves. So these are the most common things which the patient walks in. They say, if I'm not getting the hysterectomy done, probably in 10 years from now, I might have cancer of my genital tract. That is one which pushes them to get the, in spite of we counseling so many times that no, this is not going to happen with you, but still the patients do not listen to us, and indefinitely they come and pressurize us to do hysterectomy. If we don't do, probably that is the attitude of the doctors. If I'm not doing now, probably the next person will be doing, so let me go ahead with getting the surgery done by me. So that is the attitude among doctors. That's what I observe both in a higher affluent people and a poor socio-economic status person. The next thing is abnormal uterine bleeding. People are not aware of the existing non which are available. Is not being projected to the patients by both the doctors, and the lack of awareness pushes them again towards more of surgical management and hysterectomy. And as madam told, public health insurance, which was being given previously to the state of Andhra Pradesh, which had hysterectomy as a inclusive surgery in all the covered insurance schemes, people were just opting out, just walk in free, get the uterus. So that was the reason.
Cannot hear you, ma'am. That after that was the reason we lost you.
Okay.
Yeah.
So that is the reason why the patient's public health insurance, which provided free services to the patient, does the patient walk in, gets the hysterectomy done, goes back without paying, the government pays. So that was the moment where Andhra had actually maximum number of hysterectomies. Fortunately, that scheme has been removed and it has been given only to the government sector, where people assume that they judiciously do only indicated hysterectomies. When the same power is given to the private sector, it was done right and left, so that the hospital gets the money, the patient gets benefited, the middleman gets benefited, and nobody is at loss except the government, which pays the money. So that was the scheme which was provided. And fortunately, we are thankful to the administrators for removing it, so that now the Arogyasri scheme doesn't support private doctors or private nursing homes to do hysterectomies. That is one of the reasons. Then, next from the patient side, they relate the uterus to be the cause for all their somatic problems. That is one of the reasons why they want the uterus to get removed. Once their reproductive function is over, they assume that the uterus has no longer any function to do. So they want to get it removed, and they relate it everything to the somatic problems. If they have a headache, they think the uterus is the reason. If they have a chest pain, they think the uterus is the reason. So always women, especially in the rural population, they think that uterus is the reason for all the aches in the body, and they want the uterus to get removed. So it takes lot of time for us to counsel them that no, this is not the reason. Any abdominal pain, they think the uterus is the reason. So that is one of the very common thinking among the low rural public, which pushes them more towards hysterectomy. Third is vaginal discharge. Patients usually come with vaginal discharge, which is usually normal phenomenon for all the ladies. But they assume that it is a precancerous condition leading to vaginal discharge, which makes them very much enforcing about hysterectomy. So these are the things which the patients usually complain. And doctors, as madam told, lot of RMP practice is prevailing in Andhra Pradesh, especially, where, including myself, people, they bring patient and tell, please do hysterectomy. They don't even ask, can you treat the patient? They just generally dictate us. The RMP comes and dictate us, please do hysterectomy for that patient. I have counseled everything. She's ready. Just they bring, they want on the same day, they would like to get admitted. They want the surgery to be done. They don't even ask whether it is indicated or not indicated. It is such a prevailing practice in Andhra. So this RMP practice is one of the reasons why the hysterectomies are on the high on record, especially in Andhra. And lack of integrated, broad-minded approach among the doctors themselves. If they take a cervical biopsy, if it comes as a low squamous intraepithelial neoplasia, even doctors themselves, even gynecologists, they think it is a precancerous condition and they go for hysterectomy. Actually, they are not aware that lot of good non-surgical practices are available to treat, and it is inert, it is not precancerous, is what even the doctors need to know. And lack of knowledge among doctors is also one of the leading causes for hysterectomy. Even the doctors themselves suggest, yes, you have a cervical lesion, please undergo hysterectomy, is what we commonly see. So general awareness among public and even among the doctors community is a very important need of the heart to reduce the unindicated hysterectomies and to preserve the uterus. So this is regarding the general outline which I want to just give before, because this is the common scenario which we commonly see in the OPD sitting, and it is becoming hard to convince patients that please go home, no need of any hysterectomy. It takes me around 10-15 minutes to talk to a patient to convince her not to undergo surgery, because she's all prepared from the periphery, from her relatives, from by the local doctor, by the RMP, everyone. So by the time she lands up to me, it is all, her brain is full of hysterectomy. So I need to get those thoughts out and put my thoughts inside, which is actually a difficult scenario. So that is one. Now coming to your answers. Yes, definitely hysterectomy when indicated has to be done, no doubt. If it is for a big fibroid, if it is for endometriosis, if the uterus has an organic pathology, definitely yes, I do agree, uterus has to be removed. But unindicated hysterectomy, especially with bilateral oophorectomy, that is both the ovaries are also removed along with the uterus, yes, I do agree, it has got lot of implications in the women after hysterectomy. Like if the patient has the surgical menopause, menopause is natural when it stops on its own. If it is a surgical menopause, that is when the uterus is removed and the patient has a surgical menopause, all the postmenopausal symptoms come very faster than a normal natural menopause. So the woman can suffer myocardial infarction, coronary heart disease, most important osteoporosis, all vasomotor symptoms. And definitely the quality of living for the woman goes down day by day. A woman with intact uterus is more active than a woman who has been hysterectomized for an unknown, for an unindicated, especially cause.
Thank you, Dr. Lavanya, for bringing so many important points to the light. You shared a lot of information that we were not very aware about. You shared about the fear that people have, especially in the state of Andhra Pradesh, regarding these, uterine diseases, and because of that fear, they want to get hysterectomies done from their side. You also shared how society plays a role and how people around them are impacting their mindsets to go and get the surgery done, and that to the extent that they are not even paying attention to the advice of the doctor or the proper consultation. They are already motivated to get that done and have self-diagnosed. Another thing that you got brought to highlight was the RMA, RMP, yes, RMP thing. You also shared other valuable tips, such as awareness is required not just in low rural populations of Andhra Pradesh, but also for doctors, so that they are doing their bit well and are only recommending the surgery to those who most need it, not unnecessarily or not when alternative treatments options are available. So I would, yes, thank you so much for sharing these. I would now like to move on to Dr. Sharmila next and ask her key things that you brought into highlight, such as surgical menopause. So, ma'am, as Dr. Lavanya shared, Dr. Sharmila, do we have you?
Yes.
Yes. So, ma'am, can you please share with us in what scenarios hysterectomy would be recommended, and in which scenarios it shouldn't be recommended? And if so, what other treatment options are there, such as for people who have, what other alternative therapies that they can go for before deciding on to hysterectomy for public health awareness?
Thank you. And yeah, I'll keep my video muted because my bandwidth is low.
No problem at all. Ma'am, please continue.
At the foremost, I would like to express my sincere thanks to IHWC for inviting me for this panel discussion. And I appreciate IHWC for taking up this very important burning topic of protecting women's health by preserving the uterus, which has received increased attention in health policy and public forum debates in the recent years. I also appreciate IHWC for its campaign on Preserve the Uterus for better health. So my previous speakers have already addressed in detail about the increased number of hysterectomies being done, especially in rural areas among underprivileged women. And looking into the research data and the statistics on this aspect, as already mentioned, so if you see that most of the cases of this unwanted hysterectomies are being performed in rural areas among women of low socioeconomic status. And if you also see that the data also states that more than 2/3 of these cases are being performed in public health sector. So first of all, regarding the overall approach to this topic, the main issue is regarding the reason why there is unwanted hysterectomy. So as Dr. Lavanya has already addressed most of the issues, I would also like to highlight a few important points before going into the indications and the contraindications of our hysterectomy. In my opinion, I would consider this lack of awareness and poor knowledge about their reproductive health and rights. So due to various reasons such as illiteracy by women are the single most important factor for hysterectomy racket in rural India. So these women lack awareness about regular health checkups. They lack awareness about their reproductive rights. They lack awareness about the various treatment options available for their reproductive problems. And they also have a poor health-seeking behavior. So because of this poor health-seeking behavior, there may be a potential delay in seeking treatment at initial stages of their reproductive health problems. And also another important thing which I want to highlight here is Indian system is more of a patriarchal society, and there is a lot of patriarchal attitude towards gynecological problems among, especially in the rural population. And there is a lot of taboos around periods as well as this period days or menstruation. Hence, the women may hesitate to talk about their gynecological problems with their family members as well as with their partner or husbands. And because of this, women may hesitate to seek help for their gynae problems in their initial stages. And as already addressed, women may consider the fear of cancer also, considering that if they have even minor health gynae problems, so they think that it is going to lead to cancer in the later years, and they may be more inclined towards taking up a hysterectomy. Another important thing which I would like to approach is the women also consider uterus as a sole organ only for the reproduction, that is to give birth to children. Okay, so once they have completed their family, that is, they have 2 kids, so it is very easy to convince them, and they get easily inclined to take up the option for hysterectomy for minor reproductive health issues. So even if they have minor problems, so they easily take up this available option. Another important thing which I wanted to highlight is regarding this medical management of other than hysterectomies. So if we offer them a medical management for a fibroid or endometriosis or whatever it is, so it is like they have to come for regular follow-ups, they have to have investigations. So it is like a recurring expense for the family. So this is considered as a burden by the husband as well as the family members. And many of the women of low socio-economic status may not be able to afford it. And sometimes even we consider that medical management of the reproductive system should not be done. So it is an unnecessary intervention. They rather take the option of hysterectomy rather than treating with medical management for the uterus. So all this, considering all this, they may be easily taking up the option, and it is easy to convince them for taking up this option of hysterectomy among rural women. And also, as already highlighted, there is a chain of media reports on the government health schemes coverage across India, not only in Andhra Pradesh, across India, Ayushman Bharat, and all other health schemes as well. That these hysterectomy rates have increased under these health scheme coverages, and this raises a suspicion of unnecessary or profit-motivated procedures being conducted among these rural women. So it is really unfortunate to say that most of these rural unprivileged women have the reproductive roadmap of early marriage, closely spaced childbearing, complete their childbearing at an early age, and undergo an early hysterectomy. That is a sad state of affair in many of these rural women. So that is the overall highlight of this issue. Now coming to the indications for hysterectomy. So hysterectomy is mainly done for gynecological problems such as fibroid uterus, such as endometriosis, severe pelvic inflammatory diseases, for abnormal uterine bleeding presenting with the polyps, adenomyosis, as well as many of the gynecological malignancies or cancers like cancers of the cervix, cancer of the endometrium, as well as cancer of the uterus. So these are the common indications. And most often, if the patient come early to us, so we assess them by by examining them, taking a detailed history, as well as by evaluating them with ultrasound. And if there is an option for medical management, we always offer the medical management to these women. And there are a number of medical options available other than the hysterectomy to offer for these problems. The number of hormonal options as well as non-hormonal options for these issues. Some of the cases don't even require any treatment. So what we call it as a conservative treatment or an expected management. So not all fibroids require a hysterectomy. So if you see, do a routine scan for at least some 10 women. So almost 3 or 4 of them will have a seedling fibroid, will have some type of lesion in the uterus. And this is common in the reproductive age group. So it doesn't mean that these women should have an hysterectomy or should be treated for. If they are asymptomatic, we can just give a conservative or expectant management for these conditions. And coming to the medical management, so the commonly used drugs, there are non-hormonal methods available like NSAIDs for taking care of the pain as well as the bleeding, hemostatic agents like tranexamic acid, and several hormonal pills are also available, like low dose OCPs. Okay, several progesterone combinations are available. That is oral progesterones, depot injections of progesterones. Another progesterone which is coming up in a big way is this LNG IUCDs, levonorgestrel intrauterine devices, which contains the hormone progesterone, and it releases it and it takes care of the problem. So various problems surrounding this hormonal imbalance leading to the health issue in the women. There are also other available treatment like GnRH analogs, and there are several newer treatment modalities also. Several estrogen receptor modulators and progesterone receptor modulators have been available. And with regards to surgery also, there are newer treatment options in surgery. It is not only the hysterectomy is the only option. Only the fibroid itself can be removed, preserving the uterus, what we call it as myomectomy. So that is another option which is available for women of reproductive age group to preserve their uterus. And several minimal invasive techniques have also come up, like myolysis, uterine artery embolization, and magnetic resonance guided focused ultrasound. So these are some of the recent advances which are available for treatment of fibroids. Because I discussed about fibroid because that is one of the most common indication for doing a hysterectomy among women. And as I've told you, not all fibroids require hysterectomy. Most of them are incidental detection, asymptomatic, and these women can just be followed up every 6 months, provided they are compliant to follow up. So these are the various treatment options available. And coming to the cases where it should not be done, as I've already addressed one of the things, some of the incidental diagnosis, like incidental diagnosis of fibroid, asymptomatic cases. Some of the places, women, as Lavanya Madam has already addressed, women are being convinced to undergo hysterectomy for white discharge, vaginal discharge for vagina, discharge for vagina. So there are medical treatment options, several antibiotics available for treatment of pelvic inflammatory diseases. So hysterectomy should be considered only as a final resort when medical methods fail. Similarly, for endometriosis, which is another problem which affects mainly the women of reproductive age group, there are several medical options available. So all these medical options should be considered before offering them or opting to hysterectomy as the final result. Thank you.
Thank you, Dr. Sharmila, for pointing out all those facts and things. So, so far into the session, we were able to discuss many aspects around hysterectomies. We discussed why this data is so much around the state of Andhra Pradesh. As Dr. Devi shared, the studies were done only at a specific period of time, and there is migratory population and all other reasons. We also saw that now these hysterectomies that have been carried out, there was a fear in the people regarding uterus and hysterectomies and the potential future implications if not being removed right now. So these misconceptions also led to such large number of hysterectomies in this state. We also saw that lack of awareness was something that everybody pointed out. Lack of awareness not just in patients but in doctors as well regarding what treatments to prescribe if not hysterectomy. So coming on to Mr. Manoj next. Sir, can you please talk about how public health initiatives can help in generating awareness, not just amongst low rural population of Andhra Pradesh, but also amongst doctors? What can we do, and what work that you have been involved with that can help with this? Over to you.
Thanks a lot, Dr. Savrian. Well, everybody was sharing their thoughts. I'm happy that we are coming together for this discussion around a very important topic, which is close to my heart as well, around HMB, heavy menstruation bleeding. We know what as a society in India is, but also is a large player in women's health we have been focusing in this area for a number of years. Yeah. Actually, one of the treatment modalities which Dr. Sharmila was saying is LNG-IUS. It's an old product, it's 30 years old. It is a national essential list for medicine, so it's under price control. So we are essentially participating this from a perspective that is an important stakeholders in women's health, what we can do. Yeah. So three things we are outlining from a perspective of what we are trying to drive in this Preserve the Uterus. In the past, we have been constantly working with gynecologists in communities wherever it is more prevalent. But this year, we have signed an MOU. We actually launched it in Q1 this year with Foxy. So Bayer and Foxy have come together, and IHW is also one of the partners now, and we are happy with that. To essentially look at three things: how do we upscale doctors, including RMPs? We don't meet RMPs per se, but I think with greater awareness and upskilling of gynecologists, capacity building in terms of what is available in the market and what could be done to manage HMB so that there are less hysterectomies. So that is one segment. Over the last 2 years, we have roughly done various training program, workshops, continued medical education to reach out to almost 2,000 HCPs or gynecologists. This year we are planning 5,000. Yeah, so that is one. The second is, which also was alluded by many speakers, but mostly by Dr. Devi, around creating awareness. Yes, either in rural settings, but also in urban settings, people are not aware. And I think that was also a question as to how public health initiatives can generate awareness. And we know now, coming out of COVID, hopefully we have come out of COVID, is in 2 years, the importance of hand washing, importance of masking, if you even look at vaccination rates in India are very, very high. Yeah. So if we do a mass awareness and doing public initiatives in local languages, in communities which are impacted more, and that's the reason why we are doing this Andhra chapter. I think gradually we can build that awareness that just like any other organ, there is no option to remove the organ, and similar is the case. So do not go for hysterectomy. I think giving them better awareness, but also options around where they can seek information. Yeah, in local language, on social media, on multiple things, in doctor's clinic. I think Dr. Lavanya was trying to say that she takes special effort for 10-15 minutes to really help the patient or the PCP or the primary care health physician who has come with the patient to really say that removing hysterectomy is not the right thing. Yeah, so focus on building awareness. And the third factor is around public-private partnership. We can't do alone as a private player, as a small player. So reaching out to the government stakeholders, as we are doing it today, a roundtable with Andhra. We have done similar in many other states wherever the hysterectomy rates are very high, so that we can work together with the government, the state governments, to really see what tailor-made solutions could be there, but also generating white paper, generating data. Yeah, so that we try out and do a pilot by providing free treatment in some of the medical colleges or hospitals, so that the communities understand that if a hysterectomy is not being done, what sort of a quality of life, long-term impact. I think both the gynecologists were saying clearly on cardiovascular is difficult to assess in a pilot or in a small, but I think short-term the benefits of what an alternate therapy is there. Yeah, so these are the three initiatives which we are doing, and we have seen enough on the ground in India, right from polio campaign to I mentioned in the COVID, awareness, mass awareness can do a major, play a major role in terms of positively impacting the society and the community where we live in.
Thank you, Mr. Manoj, for sharing those. While you were explaining about HMB and how to manage this and everything, and all the different things that Bayer has been involved with, what are the key and the biggest challenges that you have been facing in this project, in your mission to reduce the number of hysterectomies all around India? What are the major challenges that you have been facing? And what support would you require now that we have government representatives over here as well from Andhra Pradesh? What sort of support would you require from the government side, from the private side, from the public side, so that we can work voice out these things in the session today, and also have a better understanding about where this project can go next. We have seen the power of mass awareness regarding in COVID recently, that if we are able to make people aware, we are able to stop big diseases such as COVID-19. So we hope the same for hysterectomy surgeries in future as well. So over to you.
Yeah, I don't think there is challenges as we heard Dr. Devi as well as Dr. Lavanya and Dr. Shamila. I think everybody is aware of the problem. So I don't think we see it as a challenge that understanding, because sometimes understanding the problem itself is a challenge. Yeah, but in the case here, at least the community or the stakeholder, the major stakeholder is gynecologist as well as the state government officials, or those there they see definitely this is a problem statement, so they don't see it as a challenge in terms of an understanding challenge or a difference of opinion. Yeah, so we are all on the same side of it. Now the challenges are how do we execute whatever we are planning. Yeah, and as private player, our role is essentially we are willing to partner with anyone required, but it needs a Herculean effort. Yeah. First thing is around awareness. How do we create awareness? Today we all have short span of memory, because we have social media, we have so much happening around us at our times. How do we give credible information which is bite sized, which is in a language which is understood by the community, so that it is being retained? And I understand the problems what Dr. Devi was saying, that some are tribal women, some are in rural, so they are not educated. How do we pass on information, communicate to them, and on a regular basis, so that they are understanding what is HMB, how can they take care of heavy menstruation bleeding, what are the choices, where they can reach out if they need to be. Yeah, so that is one, I think, in terms of awareness. Second is around partnering. Yeah, as I said, we have signed a memorandum of understanding with Foxy, and Foxy is one of the largest gynecologist association across the globe, to really partner with them to see, because it's a prescriptive drug and I can't give a treatment, it's only the gynecologist can give the treatment. So how can they become the bridge, exactly what Dr. Shamila was saying, as to or Dr. Lavanya was saying, as to explain to the patient that what is good for her, what could be a long term repercussions of hysterectomy if it is done where it is not indicated. Yeah, so of course, yeah, and explaining those data points and help them to understand and be part of the community, be the front end, and whatever is needed there. Yeah, so that I think is one of the challenge. And the third is around how do we work with government to have state governments to have programs. We all know anemia is a major focus area. Yeah, but we also know HMB is a cause of anemia. Yeah? And if we address HMB, partly it addresses also the anemia topic. Yeah, so how can we work with the governments to have integrated program for women's health where HMB also becomes a focus? I know there are a lot of governments, including Andhra, which is focusing on menstruation hygiene, which is focusing on women's health generally, but also on anemia. I think Dr. Devi herself was saying so. So how can the HMB also becomes an important topic, and probably Bayer is willing to participate in those. Yeah. Back to you, Savri.
I'm sorry about the momentary break. It was some technical error. So with the emerging technology, we face all sorts of cons as well, and not just the pros. So excuse me for that. Moving on the conversation ahead, we would like to know from Dr. Devi next that, ma'am, as you shared, that these data that were created, that were studies that were done, were specific to one period in time, and hence we were able to see so many number of hysterectomies emerging all of a sudden. So is Andhra Pradesh government doing different sort of data analysis and studies regarding the around the topic of hysterectomies? Do we have more data and more awareness now? How is the scenario in current time in 2021 all up till now? Over to you.
Yeah, actually, government of Andhra Pradesh not having that much specific data, how many hysterectomies going on private sector and public insurance schemes. That only the data we have, but other than specific data, we are not that much analyzing the data we are not having. But really, it's comparatively whatever studies done, that much decreased nowadays hysterectomies because of we are going to actually we are doing an awareness, creating awareness among the public at the field level, community level. We through ANMs and other things, because nowadays we are doing NCD screening. NCD screen, under NCD screening, one is the component is the cancer screenings. So that at the MLHPs we have one of the things, they are trained persons, they are doing at the field community level screening BIA test. That thing also we are doing, and also we have pap smear tests also at the community health centers, and it is like that in government sectors. We are vigorously nowadays we are doing cancer screening also, and other aspects in the adolescent health. We are focusing on that because that is the age above 15 years group children, girl child who are having. In the schools also, in school health program, we have brand ambassadors in the school, because that is the peer group. We are there is a peer groups also we are having, because if we are telling anything, but some peer group, peer education also very important. That is also we are focusing on that. Next thing, we have so many platforms in the VHND's platforms and self-help groups we have, and Anganwadi, through Anganwadi centers also we are doing all the lot of we are doing awareness and everything. We'll see what will happen. Since 1 year we started this, and nowadays we are going to family health physician concept also, because our medical officers going to the village level also, so they will create awareness, and also they are testing whatever the gynec problems, especially not all the problems, not all the cancers, whatever thing is specifically we are identifying in the school health gynae, any child having gynec problem with adolescent age group, and other women also. So these are the things we are doing. So, and the awareness of the, we require in more vigorous awareness also very important, because in rural and tribal areas, as sir said, language problem, because in social media that is a pictorial videos and posters that will be very useful, I think. So that thing also we are thinking about that. We'll see what will happen.
Thank you so much for sharing all those developments, ma'am. It is great to know that Andhra Pradesh government is working at their max capacity to get this problem sorted as early as possible. There is a multifactorial approach that has been followed, not just focusing on one aspect, but on different aspects, such as providing screenings on primary health level, as community tests, as well as focusing on adolescent health, and with the help of peer groups, self-help groups, and other groups. Also, adopting the family health physician model. Can you please share with us if Andhra Pradesh government is also working on data collection around hysterectomies or gynae related health issues? If there are any plans or protocols being planned for or existing or coming for the future?
Yes, we are doing and working on that. Presently, we have the data. We are collecting the data. How many adolescent girls having any problems at the school level and college level? Also, that thing also we are focusing on that. We have some apps we developed in the apps. That thing also. So cancer screening also we have. How many cancers screening also done, and in that particular data also we have. So these are the things, and we are doing, and also consistent rhythm plan is going on, because other department convergence meetings and convergence action plans, because it's not at the awareness all the things not in the not only health department, and other departments help also very important, so that we are going to consistent rhythm aspect also. Women and child, working with women and child welfare department also, and other thing, I mean other departments, and panchayati raj and gram panchayat ward secretariats department also we have. All convergence plans we are doing, and definitely cancer is the, because our actually what is the thing is cancer's project is we are doing nowadays, so that we are thinking about the all the things, and whatever alternative methods expect hysterectomy. So those things also we are thinking. So 1 or 2 months we will be able to all the things will be platform.
Thank you so much for sharing that, ma'am. That is some very great news and very nice plans that the government is doing for generating awareness, for reducing the number of hysterectomies, and for limiting these misconceptions all around hysterectomy surgeries. So, moving on to Dr. Sharmila next. Ma'am, do we have you with us? Dr.
Yes,
Sharmila? Yes. So, ma'am, we would like to know that how can we address the gaps in gynecology care that are there around clinicians in Andhra Pradesh? How can we address those gaps to ensure empowered and informed choices by women, not just by doctors, but also making people in general, especially women, aware about the importance of their health and reproductive issues? What would be your perspective on this?
Thank you. So, as we have already discussed, the single most important factor for the raising number of hysterectomies, unwanted hysterectomies, is the lack of awareness among the women, among community, as well as among some of the health professionals. So, in my opinion, the only way to curb this practice of unwanted hysterectomy is by raising awareness, by dissemination of information to the women, especially in rural areas. So the information is should be done by the dissemination of information should be done by the government, but government cannot do everything. So the other NGOs, as well as public health initiatives, as well as community representatives, should join hands with the government in spreading awareness regarding this unwanted hysterectomy. So this attempts to weed out this unwanted hysterectomy among rural women needs a holistic approach. So there is a need to spread awareness among the health professionals and among women in the community. With regards to spreading awareness among the health professional, so the medical organization and bodies should conduct a periodic training as well as workshops for the health professional as well as doctors, for educating them, for upskilling their knowledge regarding the various treatment options available for the various women gynecological problems other than hysterectomy, the newer modalities of treatments available, and and they should also be trained how to provide these treatments. So that they should not be only aware of these problems, of these various modalities, but they should also be trained to provide this. For example, how to insert an LNG IUCD, and all this need specific training. So that has to be provided by periodic workshops. Now, coming to the most important aspect, that is awareness, spreading of awareness among women in the community. Uh, this information regarding the sexual and reproductive health and rights of women should be disseminated to them through multiple modes and media in the vernacular language, and also by people-to-people contact, like word of mouth spread, in order to increase the health-seeking behavior of women. So government should set up task forces of government officials, health advocates, and community representatives to spread the awareness of unwanted hysterectomies. And one of the important aspects which will help in spreading the awareness among the rural population is, I feel that we have to train the grassroots level workers, that is the ANMs and ASHA workers. So if you see many of the reasons for many of the successful programs, like immunization of the antenatal women, vaccination during childhood, providing female sterilization, IUCD insertion for contraception, all of these have become very successful because of these grassroots level workers, because these are the people who are in direct contact with the community, these rural women. So they go house to house, they see these women, they talk to them, they listen to their problems, and they take them to either the RMP or to the tertiary or secondary level healthcare system. So there is a need to train these grassroots level workers, midwives, ANMs, and ASHA workers about the various reproductive health problems that need medical attention, as well as the various treatment options available, because they should be made available so that they take it to the community. Because you see, in the urban setup, we can easily spread the information through mass media as well as social media. But those underprivileged rural women, they do not have the facility for mass media or internet facilities. So it is not possible to reach out to them. So the only way to reach out to them is by training of these grassroots level workers. So I feel that they should be made as stakeholders to participate in this issue of preserving the uterus to protect women's health.
Thank you, Dr. Sharmila, for sharing all those tips. I am sure they are very valuable, and the officials are listening, so that these can be implemented and looked at, and how, so that we can improve these incidences of hysterectomies. Do you think that there is a need to fix the accountability on doctors, private doctors, especially in the private sector, through audits? Would that work as per your experience? Should that be done? And if not, then why? And if so, then how?
Thank you. So as per the NFHS 2015-16 statistics, if you see, as we have already discussed, the overall prevalence of hysterectomy among women of 20 to 49 years is 3.2% across our country. And Andhra Pradesh state ranks the highest with 8.9%. So given the upsurge in the increasing rate in the state of Andhra Pradesh, it is pertinent to ask this question. So as I have previously told, the two phenomena which need to be noted for this upsurge in the unwanted hysterectomy, one is the rise among the rural women of lower socio-economic status, and second, the prevalence, the rates are high in the private health sector. So to curb the high rates among rural women, as we have already mentioned, we have awareness among women, community, as well as the gynecologists regarding the various treatment options, the various non-surgical treatment options available for the various women health problems. Now coming to how to curb the high rates in private health sector. So that was your question. So at policy level, there is a pressing need to improve the access to as well as quality of care in the public health sector in order to reduce the growing dependency on the private health sector. So the quality of care at the public sector should improve so that more and more people don't go to the private health sector. And also the health policy should focus on shifting from tertiary level care to primary level care. As I've told, that it should be strengthening of the sub health centers, primary health centers, as well as CHCs, because these are the first point of contact for women of rural India. And we should also make the informed consent real. So a consent for hysterectomy, when we get a sign, it is only a signature placed by the patient as well as by the witness. But most often the contents in the consent form is not explained to them as it is supposed to be done. So we are supposed to read out the consent form. We are supposed to tell why this procedure is done, what is the indication, what are the risks, what are the complications, and what are the advantages, what are the disadvantages. All these have to be explained. So that is called as an informed consent. So that is most often being neglected. So it is just a namesake that we get a sign in one's paper. So patients also have the feel. So it should be a real informed consent which should be taken. So that should come up in a big way, and that has to be stressed upon. And regarding private health system, so definitely private healthcare system should be made accountable, and it should be transparent and should be made transparent. So there should be some kind of regulatory mechanism while paying to this private sector through health schemes. So, for example, like auditing of hysterectomies. Just like now, you see, we have to upload all the forms regarding the number of PCPNDTs done for the scans. We have to upload the number of medical termination of pregnancies which we are conducting. And now another thing which the government is insisting in the raising number of cesarean sections. So that is also now come under audit. So every month, the government as well as private sector has to submit to the government regarding the number of C-sections being performed in their hospitals. So similar to these MTPs, ultrasounds, and cesarean section. So there should be auditing of hysterectomies also. So there should be some IT support to the government as well as to the health schemes, where all it becomes mandatory to upload the details of the hysterectomies performed every month, what was the indication and the follow-up of the patient, etc. This is one of the important things. So which I wanted to stress upon, that is auditing of the hysterectomies. But of course, when we do this, the another school of thought is that women who really need the hysterectomy as a life-saving procedure may be deprived of this because of these stringent measures taken by the government. Because the public as well as the private sectors may be a little apprehensive to take up the case of hysterectomy just because they have to fill the form, they have to do the auditing, they have to upload, and all these aspects. So that is another school of thought. But we have to think of some ways to address this issue of auditing the hysterectomy done in the private health sector in order to curb this issue. And of course, there is a lot of data which is lacking. Like whose decision was it? Was it the doctors or the husband or the patient herself, or how long she needs the? Did she receive any prior treatment, and what is the source of finance, and how long she's been suffering from the problem? So there is a lot of scope for research. So future research has to be taken in these aspects so that we may get some possible solution for curbing this issue of unwanted hysterectomy. Thank you.
Thank you, Dr. Sharmila, for pointing out those valuable tips. I remember that my mother also faced with heavy menstrual bleeding and has gone hysterectomy in year 2006, I believe, if I'm not wrong. So with that, you were able to point out the pros and cons of auditing very well. Definitely government needs to look into these things, and if it would be beneficial, then sure, we need to go ahead with that. Let me come on to Dr. Lavanya next. Ma'am, is there a role of STDs and infections or uterine infections in increasing the incidence of hysterectomies? The role of sanitation and menstrual health and hygiene in avoiding infections, is it related to or could potentially lead to having to get hysterectomy, or is it all just a myth? Please clear it for us.
Infections as such contributing to hysterectomy is very, very less, because we do have very good antibiotics right now. which can actually tackle the infections very well. So I don't think infections are going to contribute much to the hysterectomy, except that if it is very aggressive infections causing upper reproductive infections and pelvic abscess, in those situations, of course, we have to resort to surgical management when the medical management doesn't prove helpful. But majority of the times, I think infections do contribute very less to the surgical management. And yes, few infections like HPV infection, recurrent HPV infection can lead on to precancerous lesions of the cervix, which can actually be a factor for the medical practitioners to decide on hysterectomy. So, of course, now to prevent that, we do have HPV vaccination, which has become very much aware among the public, and hence adolescent group, if they get vaccinated, they have protection against this HPV, which can have a long-term implication on their long-term reproductive outcome. As such, sanitation, all these things doesn't much contribute. Of course, it goes in a good reproductive health, but of course, direct sanitation improvement is not as we curb diarrhea and infections like reproductive tract infections doesn't mainly depend on sanitation alone. Of course, it would help them in having a healthy, leading a healthy, happy life. That's it. But as such, improving so much of sanitation doesn't improve the reproductive outcome as well. That is one. Second is menstrual sanitary napkins. Educating the women on using menstrual cups instead of using sanitary napkins. I think it should be encouraged a lot. How much ever we tell them, they still keep using the sanitary napkins, which is an environmental hazard as well. They dispose it and it is all non-biodegradable and it is adding to the pollution of the environment. So for both their safety and for the environmental safety, I think educating the women on using menstrual cup, which is very convenient, which is very environment friendly, and as well as patient friendly, has to be very much encouraged among the public. So, and supply of menstrual cups by the government of India as a free supply is going to again have a very good impact on the health of the women. So, I think that way, more than sanitation, if we improve the menstrual hygiene, it's going to be very contributory to the health of the women, though it might not help in reducing the number of hysterectomies. Though we are just deviating from the topic, still I think that has to be very much stressed upon. And of course, sanitation and good hygienic practices are always a helpful hand in having a good reproductive life.
Thank you,
So
Dr.
as I
Lavanya.
am told, every doctor should just question whether we are doing the right thing by doing a hysterectomy for that woman. Are we justified in doing? If every doctor just keeps 1 minute of her time on her heart and asks whether this in hysterectomy is indicated, similarly, every patient, if she self questions, yes, do I need to undergo the surgery? Then I think that is the final solution where we can have really indicated hysterectomies and we can conserve the uterus. So I think every doctor should actually put her hand before operating on a woman. Just is it really indicated or not? That's a very important thing I think we should do.
Thank you, Dr. Lavanya, for sharing such strong points again. And definitely, it moved all of us. In the medical fraternity is listening, I'm sure. So, as all our eminent guests have been involved in this topic and are aware about this, Mr. Manoj, you also have been involved in this topic very extensively. So, what would be top 3 things that you would want the government's attention and the medical fraternity's attention on, if there were just 3 things that you could tell them to focus on for reducing this, what would those be?
No, I think just now Dr. Lavanya also spoke around it. I won't really, uh, you know, tell the government what needs to be done. But I think from a private, perspective, as an important stakeholder in the women's health, as well as some, as representing a company which has long legacy of bringing innovative solutions for women's health, our approach towards this topic is also how can we partner and partner to really contribute to have a positive impact. Yeah. And even if we are able to help the communities to reduce even just one hysterectomy, for example, it's a significant contribution from everyone. So I guess we are looking at how do we partner with government, partner with private, partner with the healthcare practitioners like gynecologists, and other community members as well, so that how do we build uh, an approach where people are openly talking about it, building awareness around HMB, and also giving the women a choice, what choice she wants to have before she decides to go for hysterectomy. Yeah. And for that, I think Bayer is looking to partner with anyone. We are also reaching out to a lot of other companies which have common interests in women's health, so that we all know that we can't do it alone. So we need more partners, partners like IHW, for example, which can come together and come for a good cause. Yeah.
Thank you so much, Mr. Manoj. And I'm sure we can go on discussing on this.
Communication.
Yes, please.
Mass communication, mass education, I think is the best measure to reduce this. Just as we say, no, buy Swadeshi products, don't buy foreign products. Same way, we should tell them, don't get hysterectomized. It is going to have bad implications on your health. Tell them all the negative points of hysterectomy so that people are very much aware. So I think the mass education is the one which is going to be a great way to reduce the number of hysterectomies. Go to a rural population, tell them, yes, if you're going to get hysterectomized, what are the problems you're going to face in the near future, and what is going to be happening to your heart, what is happening to your bones. If you fall from a small trivial accident also, you might get your bones fractured. So those are the negative things which we have to tell them so that they raise up. Because osteoporosis
Yeah.
condition among postmenopausal women. So when they get hysterectomized, surgical menopause, definitely a trivial fall is going to cause their bones. And when we say negative points, I think they'll naturally have a fear. Like when they have fear of cancer, that's why they get hysterectomized. We should tell them what are the fears they should have after hysterectomy. So those strong messages have to be conveyed to the people through mass education. Health education and mass communication is what is very important.
Very spot on, Dr. Lavanya. Thank you so much. We have your end notes already. Let me just ask Dr. Sharmila as well for her end comments. Ma'am, what would you want to say to the audience that is watching the show? Do we have Dr. Sharmila with us? I believe yes, we do. Ma'am, your last comments.
So, yeah. So, as I've already told you, the most important factor which is lacking is the lack of awareness among the community, and which has been stressed several times by all the speakers. So the only way to curb this practice of unwanted hysterectomy is by raising awareness, by dissemination of information to the women, especially in rural women who are suffering from this issue of unwanted hysterectomies. So it requires a holistic approach, and we have to join hands. The government sector, the private sector, the public health initiatives, as well as the community should join hands together to curb this issue of unwanted hysterectomy in the population. Yeah. Thank you.
Thank you so much, Dr. Sharmila. Dr. Devi, do we have you? Ma'am, your one advice for preserving the uterus to our audience that is watching, your one tip.
Yeah, first, yeah, definitely. All the participants suggested whatever government sector also very important to take the necessary steps. So first part is I would like to counseling part is very important to create awareness, and a family and partner counseling also very important in this, and family members also. And creating awareness through social media or multi sectoral, whatever. And nowadays we are some days cancer day or someday. Just like this, you train preservative day also we have to conduct that, some rallies and all the things we need to do. And also anyone interested to come to do the any program regarding on this, we are ready to give the support and all the things. Most welcome to all the suggestions who are Manos and Lavanya and Sharmila, who are given valuable suggestions also. And one more thing, creating awareness regarding this is a very, very important thing, alternative methods. That thing also we are thinking about that also. We will do definitely, because and so many programs we are implementing in this in government of Andhra Pradesh. So definitely we will take up all the advices to all the participants. Yeah. Good.
Thank you so much, Dr. Devi. Yes. Mr. Manoj, your last tips, advice, or comments to the viewers that are watching this show today?
No, first of all, thank you, everyone. I guess it's a very important topic, and I'm really, really happy that everybody understands it as a major challenge and is willing to partner together. So that's my appeal for everyone. We are looking at suggestions. How do we, strongly communicate in terms of joining hands to do mass awareness? We would do our bit, but I would also imagine we need a lot of other partners who have ideas to reach out to those and who have worked closely with these communities. So I think mass awareness is something which we would continue to take it up, also at a very local level, so that we as someone was saying, that it needs to be pictorial, it needs to be in local language. I think mass awareness is something. And then we are closely working with FOXY, the gynecologist community and association, to really do continued medical education, so that doctors who are practicing in those local areas understand what is the modern management of HMB, and appropriately they can then guide the patients. Yeah. With that, thank you so much.
Thank you so much. So this was Andhra Pradesh chapter of Protecting Women's Health by Preserving the Uterus. We discussed many aspects on why this is such a big problem in Andhra Pradesh, the potential reasons, what can be done to preserve the uterus of women going forth, what the government is doing, what advices the private sector of doctors have, as well as what government sector of doctors advices of the government sector has. So with that, we wrap up this super informational session today. I would like to thank Dr. LBSH Devi, Dr. S. Lavanya, Dr. Sharmila V, and Mr. Manoj Saxena for taking out time from their busy schedule, for sharing us all the knowledge and information that they have regarding this issue, for generating public health awareness. I would also like to thank all our audience for staying with us till the very end for this live session. Thank you so much. With that, I am sure we would be interacting with our eminent dignitaries again on this very crucial topic in future multiple times. But we wrap up this session today. Thank you so much. Have a nice day ahead. Thank you.
Thank you.
Thank
Thanks
you.
a lot.